It's been a collaborative effort with the Department of Health, our own experts, Brown University, and Brown University's Policy Lab. By the way, I want to give a huge shout out of thanks to Brown University. I called you over a month ago, and you gave us your very best statisticians and public health experts and epidemiologists. Thank you for being a great partner. We are using, there are a lot of models out there, you've seen them all. By the way, none of them is perfect. We are basing our model off of a framework that's been provided to us from Johns Hopkins University. We reached out to Johns Hopkins several weeks ago, and we've been validating our work with some of the experts at Johns Hopkins. That team of people that I just described, our dozen people, plus Johns Hopkins, has also been consulting with their counterparts at the University of Washington. And together they've crafted a model that reflects where we think we are at this time. It is a combination of what we know about the virus from other countries and other communities that are ahead of us, and also the actual Rhode Island experience. But this is directionally correct. We've been at it for 6 weeks. We have dozens of people around it. We're talking to everyone we know. This is directionally correct. So what you see on the screen are two lines. There's a blue line. The blue line you can think of as our best guess of what we think the next few weeks will look like in Rhode Island. The blue line assumes all of the current restrictions, the stay-at-home order, the mask wearing, the social distancing, are in place, and we're doing a pretty good job of adhering to that. Not a perfect job, but a good job of adhering to social distancing. In that scenario, we think our peak will be around May 3rd. That means, last week of April, first week of May, approximately. And at that time, we'll need about 2,250 hospital beds. So, a couple points. That number of hospital beds is a number that we could handle within our existing healthcare system. Every hospital has been working with us furiously to put in place their surge capacity plans within their hospital. And the 2250 would allow us to hospitalize everyone at that peak in our existing hospitals without having to go to the overflow hospitals that we are simultaneously building at the Convention Center and in Cranston. It will be difficult. It will be very difficult. Probably the hospital administrators are getting a little nervous because they're going to have to execute their surge plans, but it is possible. Above that line on your screen, you should be seeing a red line. That red line represents what we think will happen if we stop taking social distancing seriously. And in that scenario, the peak comes sooner, probably closer to April 27th, and obviously the peak is much higher. In that scenario, in the red line that you're seeing, we'll need closer to 4,300 hospital beds.